Hey guys, welcome back to clinicaltrials.gov. Again, it's the Clinical Trials Guru. Keep your questions coming in. Today's video is going to be short and sweet and to the point. And this is not inspired by one question in particular. It's kind of a theme. I've been getting so many emails. My last video I just did was, hey Dan, my PI doesn't have much experience, but how do I get studies? And I talk about the importance of hustle and effort constantly on this show or on these videos, but using clinicaltrials.gov, I swear to you, if this was any other industry, let's take real estate as an example because I'm in the real estate industry as well. Okay, if you can tell me or any other realtor out there that, hey, I have a tool, it's completely free, you can search it, they update it every day, and you can find out what's new on the market, who's looking for new business. I mean, they pretty much do everything but tell you these things. But if you know how to read between the lines, you can find out which studies are recruiting sites or needing sites at that time. So again, if you told me as a realtor that I have this free tool, it's online, you go there and you get customers, you get business, you get leads for free, I mean, there would be so many happy realtors out there. And I think in our industry, clinical research, we kind of get spoiled and we kind of forget that this is a business because there are other aspects that go into this. Unlike in real estate, where most realtors are just focused on getting sales and that's it. In our industry, we're in charge of getting our staff trained, we're in charge of recruiting patients, we're in charge of contracts and budgets. So getting the sale, closing the sale, finding a study is not given our 100% full attention. And I'm not telling you that you should do that because we all wear many hats when we're site directors and whatnot. But clinicaltrials.gov, I believe, is still the most underrated website in our industry. You can go. I just spent 2 hours today looking for studies for one of my sites, and I found 12 leads that were not there 2 months ago when I did this last for that site. And don't just stop with clinicaltrials.gov. Use that as a starting point. For example, not all study directors on clinicaltrials.gov are going to have their names there or their direct email. Now, an astonishingly high number of them do. I just found from the 12, 6 of them had direct emails to the study director or the project manager. The other 6 did not. They had a 1-800 number. I never had much luck getting much information from those 1-800 numbers, but what they do have there, what you do know, is the sponsor, and you have the full protocol number. So you can call that sponsor and find out who's in charge of this particular protocol, and then find their information and their contact info that way. So don't just stop because it's not on clinicaltrials.gov. That's the lazy way. Don't just stop and give up and go to the next one. Go to their website. Once you find out their name, add them on LinkedIn. Start having a dialogue with them. Maybe they have a Twitter. Maybe they don't, but it is likely these days more and more people are signing up. Maybe Facebook stalking a little bit if you're comfortable with that. Although that I would not recommend, but LinkedIn is enough. Finding their email is enough. Finding their phone number is enough. Don't just stop because clinicaltrials.gov gives you a 1-800 number. So anyways, just a quick little video on why I think clinicaltrials.gov is so underrated. If you really think about it, if you're on clinicaltrials.gov every day for 8 hours a day for an entire week, it's almost impossible for you to not get one study. So that is like free money, or the closest thing to free money that you'll find in any industry. And I think we're a little spoiled in our industry for having it so easy. Hopefully this helps you guys out. As always, send me your questions. I'd love to hear back from all of you. Dan at clinicaltrialsguru.com. Take care.